My name is Mike Doyle. I'm the the senior responsible officer for the West Yorkshire and Harrogate ICS for suicide prevention, and I've been involved in developing the strategy since around about 2016. And together with my colleague Lynn Harrison, we've done quite a lot of work recently on looking at developing the strategy and developing plans for our achieving our strategic objectives with a small team from across West Yorkshire through lots of different agencies. We're a Wave 3 site in terms of we didn't get any Wave money until April this year, and but prior to that we successfully bid for some funds around Trailblazing and some bereavement by suicide funds, and we also got some transformation funds which helped keep us going while we were waiting the Wave funding. So we're really we're establishing ourselves, although we've sort of been at it for quite a while, and we've achieved so much. And I just want to highlight here we've got our latest annual review and plan that's published on the website if anyone's interested, to show exactly what we have done. So I'm just going to very quickly just give a very quick background, look at progress, then talk about our communication strategy, and thinking about some of the issues and considerations. I'm also going to talk very briefly about some of the lessons that we've learned, which I think are really important for everybody in this area, and then talk about the next steps. So within West Yorkshire and strategy since 2017, and we have a suicide prevention advisory network, which is multi-agency, covers all health, social care, public health, blue light services, prison services, and the third sector. And that's our aim, really, to develop working relationships, to provide evidence-based practical frameworks across the region, to reduce frequency of suicide, minimise associated human, collateral and financial costs. So very, very similar aims for everybody on here, I guess, in terms of what we're trying to aim for. We've done quite a lot over the years in developing the partnerships and the engagement, but also linking in with different agencies and organisations and key stakeholders, and more importantly, combining them, getting them to interact and work together. And we've worked across our health sector as well, developing zero suicide ambition plans and looking at we can share good practice and pool resources where possible. We've also looked at engaging experts by experience, and we've developed training around assist and safe talk, and we've trained trainers including West Yorkshire Fire and Rescue Service staff who've become assist and safe talk trainers, which has been really helpful in spreading the word around these particular programmes. And the real-time surveillance model is being developed, and that's one of the things we're going to focus on towards the end of this year and early next year. 3 areas that we've focused on in the last couple of years is the Trailblazer, which I'm going to talk about in a bit more detail, post-vention funding and the suicide prevention campaign. The Trailblazer is very much looking at a pathfinder approach in terms of working to provide a service for men, and acknowledging that men who need help will be at various stages on that pathway, in terms of some might need emotional support, and some might need secondary mental health services, some might need hospitalisation. So it's acknowledging that there's lots of different stages on that path that people need to where people access services, and that's what we provide through the Trailblazer funding. We've also established close working relationships with State of Mind. I'm sure people have come across State of Mind. That's the organisation that uses the sporting metaphor, in particular rugby. And we've been working with them. I've been involved with them since about 2017. One of the appeals of State of Mind was very much how well they engaged men. They've been really successful at engaging men. The support that they get from statutory services in terms of mentorship and supervision, which I think is really important. And the evidence base, it's been independently evaluated and found to be very successful in achieving their goals. So it's very, very appealing to us, and we've been working very closely with them. also been doing working with Leeds Mine to provide bereavement by suicide services, and that had to be expanded shortly after initiation because of the demand, and actually that's moving now into looking at supporting people under 18 as well. And then underpinning all this, we have a suicide prevention campaign. So what I was going to do really is just talk about some of the aspects of that and what's really important about that, because we've sought some expert advice in how we actually raise awareness. The aim of this really is just to inspire individual action, reduce suicide, and target various audiences, and reduce further suicide and highlighting services for the bereaved. So those are the three key aims. We have, we're actually at the moment we haven't actually signed it off, so this is about 1 week too early, but we are at the moment, we have commissioned a specialist organisation to help us with this, to look at a campaign strategy. This is one for working with a reduction campaign aimed at staff in all different areas of work and industry. But just to give you an example of the sort of areas we're looking at, we're trying to make sure that every organisation across the partnership embeds a campaign. And we're trying to normalise the conversation, increase confidence, so people feel comfortable talking about their issues and mental health without stigma or judgment, and working together and making sure that the services are there in a timely, safe, effective, responsive way when people are struggling. And they're going to make accessible tools and resources and signposting for people as they require it. So these are just some of the key objectives of any of the, the campaigns that we're operating. The framework that's being used is the behaviour change framework. I know there's lots of different frameworks. I'm not by no means an expert in communication strategies, but I do understand that there are lots of different frameworks, and this is one that the company that we've commissioned are advocating about, the behaviour change framework. And as you might expect, this is looking at co-creation, education, signposting to resources, raising awareness, promoting lived experiences, reminding and encouraging, so that once we've hooked people into it, that they're there and they know exactly where to get that service and where that's support and help is sustained, and making sure we evaluate and learn as the campaign goes ahead. So this is just some of the background really to our approach to raising awareness and communications. What I want to do now is just talk to you about the Trailblazer, and in particular some of the work that our Pathfinder development workers have been working on, and I'm pleased to say I think they're both on the call today, so they might be able to help out if I get stuck. But basically, what we did, we acknowledged, from our work over the past several years, we acknowledged that there's the huge amount of work that is going on in this area. It's surprising, once you start looking at it, how many things are actually going on and what's being provided. So one of our first tasks from last December was mapping and engaging with those services, and over 71 services engaged locally, 8 across West Yorkshire, from Bradford and Craven, in Leeds, a big metropolitan area, Kirklees, Calderdale, and making sure that we understand what they're about, really, what they can provide and how they might help, and also offering advice in between. So one thing we don't want, obviously, we're going to try and share resources, and we're going to try and avoid duplication. That's obviously a waste of money, but also we want to avoid contradiction. If people are working, operating in 2 different ways with 2 different philosophies, for example. We've got a monthly online network forum established for local men's projects, close reminders have mentioned. However, I think as the colleagues alluded to earlier about some of the challenges we've had with COVID-19, so we had a well-considered, well-thought-out plan for delivering these sessions, but obviously that was delayed due to COVID. So certainly the face-to-face was, and so that those plans were scuppered somewhat. However, what we decided to do rather than just delay and wait until we can get back together and congregate once more. We look partly with State of Mind to look at how we could do that, provide the service, but virtually. So we work with State of Mind. We have Pathfinder development workers who co-facilitate the sessions, and they have a series of sessions that run around areas in terms of mental health, emotional well-being, including mental fitness, stress management, building resilience, exploring emotional intelligence and anger management. And the branding and messaging of the project is informed by men with lived experience. And we have a video. I don't know if after it we've got time, I'll play it. It's just a very short video. And we've actually got an excerpt from the BBC Look North, which gives an example of how we publicised it through the media. What we will say is, by using this approach, since September, end of September, we've had nearly 1,000 views and 16 men have already been engaged. However, we have learned a couple of things from the campaign. One of them is there's a sense, certainly among, I guess, health and social care services, that this type of thing is for people who are not well, who might have a mental illness or mental health problem. When, yeah, we are aiming it at people who have various, stresses or difficulties coping, but they don't necessarily have to be receiving any form of formal care. And I think that's something we've learned, certainly in the first few weeks. The other thing that we've learned is that that some of the people who were really enthusiastic about this and getting people engaged, when we said, well, what's sort of impeding that engagement, they said, well, they're not suicidal. And you sort of see, with hindsight, you can see the connection people make with something like this, that you have to be suicidal. And obviously that's obviously an area that might be of concern and something that we want to help with, but people shouldn't have to get to that point to engage with this type of service. So that's something that we've learned, I think, from the early stages. So in terms of how we're progressing, we've got the first phase of the Great Minds project is up until December. So we're continuing to take the offer of sessions for men in partnership with State of Mind. We've got online, it's online in a variety of settings. One of the things we're doing as well is we're doing follow-ups, a little bit like I don't know, a double glazing salesperson. They'll ring you up and say if you're interested, and once they've hooked you in, then they'll come and see you, and they think they've got you there. Then so it's a bit that sort of salesperson pitch, really, to make sure that people get engaged. The other thing we haven't been able to do because of the not being able to meet up face to face is attract those people what State of Mind call the hoverers, that people hover outside. It's really difficult to get the equivalent when it's online, but people who hover outside who are very ambivalent about joining, they found that nearly half the people who got engaged were sort of hovering outside the venues of where they used to hold the meetings, which is really interesting, an interesting dynamic. So that's something we need to get those who get the ambivalent involved and make it more accessible. We will try to launch face-to-face sessions. Recently there was some training put on face-to-face at Featherstone Rugby Ground, Safe Talk training. So they got everybody outside in the stand, and it was successful to a degree, I have to say. I think the groundsman wasn't too happy, but from what I understand, they got people together, it was outside, it was safe, and they got all the benefits of that, congregation. We're also looking at extending the role of Pathfinder development workers to work with self-harm, primary care, and we have a new project manager starting very shortly. Crucially, we developed a microsite, and we're supporting that, which will have an extensive Pathfinder resource section. And we're exploring opportunities to showcase work with men at conferences, training events, webinars, and the media. One thing I would say, I think you should never underestimate the media, television, radio, newspapers, but you should also embrace it, I'd say. And with the right preparation, support and training, You know, it can be a bit of a double-edged sword, but generally speaking, for this work, you need to embrace it. Certainly, we do. We've done lots of we've done lots of radio, some TV, and obviously in the press as well. So that is something that we would definitely recommend. I was going to give you some examples of that.
Now, a couple of weeks ago here on Look North, we told you about the worrying statistic of Yorkshire having the highest suicide rate in England. Well, a scheme's been launched to help men improve their mental fitness. It's a partnership between the charity State of Mind and the NHS in West Yorkshire and Harrogate. Tanya Arnold's been finding out more.
Men of Harrogate, Wakefield, Kirklees, Caldervale, Bradford District and Craven, men of Leeds.
We have a problem.
The biggest killer of men under 50
is suicide.
And over 3/4 of all suicides
are men.
Men, like you.
And me. I was told I'm maybe to sit up, feed myself, walk, have children. All the things that we kind of take for granted I wasn't going to get again. And that was a difficult pill to swallow. In fact, to the point where
Jimmy Gittings broke his neck in 2 places in a game of rugby league. The love of his family pulled him through, and he's gone on to do some amazing things. One of those is as a presenter for State of Mind, which has changed his life.
I'd had the physical side of things, but I never used the mental fitness. And now, where I was struggling with physical side, which is always what I always banked on, all of a sudden now I had to tap into that mental fitness. And when I did, I realised just how fantastic it really is. And like I said, the things that you can achieve by being mentally fit is incredible.
This is a tough game. State of Mind started in rugby league, working with clubs and fans, but they now work with a host of companies which paved the way for their link with the NHS in West Yorkshire and Harrogate.
It can be really hard for guys to reach out and get support. It's hard for any of us, but we know it can be much harder for men. There's lots of messages about toxic masculinity, about having to be strong in certain ways. For us, it takes huge strength to ask for support and to come along like this. So for individual men in their numbers to come to sessions like this is a huge win. And I think there's a bigger bit about changing that culture, changing the stigma about struggling with things and reaching out for support.
Graham Hill has joined Great Minds. He had a series of strokes a few years ago and very nearly died. It left him with a brain injury.
Emotions get amplified and magnified. So anger becomes rage and you've got no control over it because it's just driven. And you're in such shock, you just don't know what to do with yourself. It's awful times.
Like Jimmy, his family got him through the worst. He's learnt the power of talking.
When I talk to great minds, they're all sharing stories. It opens you up. I know as men, we sit there and go, whoa, we can't talk about that. That's for sissies. But it's not for sissies. It's to help you get through it all. And controlling the emotions is what it's about.
Join us. For now, Great Minds are running their sessions online, but they aim to be in these communities for years to come.
Join us.
Tanya Arnold, BBC Look North.